Good afternoon, everyone. Want to thank everybody for being here with us on behalf of the five-star accredited Fort Bend Chamber of Commerce. I want to welcome everybody to this webinar. I'm Mike Dotson. I'm the chairman of the healthcare division for the Chamber. We certainly hope everyone and their families are safe and healthy. Would like to acknowledge the sponsors of today's webinar: CHI St. Luke's, Sugar Land Hospital, the Fort Bend Medical Society, Memorial Hermann Sugar Land Hospital, and Houston Methodist Sugar Land Hospital. We could not do what we are doing without their help and support, so a big thank you. Now I'll go ahead and introduce our panelists. First is Dr. Basit. Doc received his undergrad at Trinity. He attended the UT Southwestern Medical School, completed his internal medicine residency at UT Houston Health Science Center, both in cardiology and interventional cardiology, along with extended fellowships for the St. John Medical Center. He is the medical director of cardiovascular services at Memorial Hermann Sugar Land Hospital, and is an adjunct clinical professor at the McGovern Medical School at UT Health. So welcome, Doc. Next up is Dr. Jeffrey Jackson. Dr. Jackson attended Rice University and then went on to Baylor College of Medicine, receiving his MD in 1979. He is an original member of the medical staff when Houston Methodist Sugar Land opened in April of 1998. During his tenure as CQO, the hospital has achieved a rating of 5 stars by CMS and a rating of A by the Leapfrog Safety Organization, and that has happened in the last 8 cycles in a row. Last year, they were ranked number 5 in Houston and number 9 in Texas by US News World and Reports. And then beyond that, number 2 in the national comparison group by the Vizient organization. Next up, Dr. Jacqueline Johnson, mentor. And Doc, I apologize, the biography that they provided is very thin. So if you want to jump in here and tell us a little bit about yourself, we would greatly appreciate it.
Good afternoon, everyone. So I've been on board at Fort Bend County Health Department, Health and Human Services, as a repeat person, but I've been on board for approximately 3.5 months. I originally was here in 2001 with 9/11. I was here for about a year and a half, 2 years, spent some time developing the Health and Human Services department then, and have returned just in time to join forces for this unprecedented pandemic. So I think that's enough said. Maybe I'm bad luck.
Don't think you're bad luck, and I just think you might have some bad timing. Next up is Chris Siebenaler. Chris is the Regional Senior Vice President and CEO with Houston Methodist. His responsibility extends to hospital operations at 3 facilities: Sugar Land, Clear Lake, and Baytown. Prior to joining Methodist, he had worked at a few other health systems, and started in Methodist as a CFO and then a COO before assuming this regional role in 2014. So I'd like everybody to welcome this esteemed panel and join me with a big thank you. With that being said, we'll go ahead and jump right in. Dr. Mentor, did you want to start and give us kind of a recap of testing in Fort Bend and where we are and what the processes look like to date?
Sure. I'd be glad to. So right now, you probably heard a lot in the news about how many testing sites we have. So back in, I guess, late March, the federal government put 2 FEMA sites in our region. Of course, we view this as a big region, and we know that disease affects our whole region. We were fortunate in that those 2 federal sites were located close to the Fort Bend County and Harris County line. So one north, I-10 at the Legacy Stadium, and another one in the southwest part of Houston, which would be northeast part of our county, off Main Street going sort of toward the medical center. Those were very advantageous for Fort Bend County residents, and those were the sites that we could utilize. But we wanted one in our county. Obviously, our county is much more than those sites, and we wanted at least one location that was no cost where our county residents could get tested. Fortunate enough to have Access Health, to have Mike call me one day, and I said, he asked me if I needed any help, and I said, if you could pull a testing site out for us, that would be great. So we joined forces, and a week later, we had a testing site at the Fort Bend County Fairgrounds. Also, about the same time, UMMC, a group of people put together a privately funded no-cost site in Sugar Land at the Smart Financial Center. So we ran those sites for about two weeks, and what we noticed as we were looking at data is there were increasing numbers of positives in a particular area of our county. And that area was in the Missouri City area. So we also added a site there where we dedicate or we prioritize certain zip code levels to that area. And that has increased the testing in that area, and we're getting very good data from that. We also wanted to make sure that we got another site in the Precinct 3 area. So we're trying to cover our entire county so that we could have low cost or no cost convenient site testing for everyone. Access has been with us every step of the way, providing the health care, providing the backup medical to give results and to do follow-up, and also providing what we need as far as making sure that all of the data systems are together. So we have the locations, we support with PPE, they also supply our testing kits, and we purchase those back from them. So now and then we partnered, of course, with Mattress Mac at the Gallery Furniture in Richmond. So now we truly have, in my opinion, 7 sites, 5 county sites, and then we have closely available FEMA sites that are just outside of Fort Bend County. That allows us to have a high number of per capita tests that we have available to our residents. As we're seeing those testing centers, as we see more and more, we are noticing that our percent of positives is actually down a little bit, which is actually good. That means as we're continuing to increase testing, we're seeing that there are people that are testing negative. So that's a reflection, I believe, of the stay-at-home order and of people who are respecting the physical distancing and the protective measures. If people will not continue those, I do believe that we will see those numbers change. The numbers that we show on our site are only reflective of the no-cost sites where we partner with Access Health in our county. So those are representative of those 5 sites. So if you see 6,000 tests to date, those are the tests that occur only at those sites. There are other locations that list testing that occurs at the hospitals, at private sites, and outside of the county to Fort Bend residents. Also, some of those larger numbers reflect duplicated numbers. So meaning if you go and get a test once and then you go to get tested out negative, we don't count those in our numbers, but some people who are just capturing base data will capture those numbers as well. So that kind of gives you an indication of where we are with testing now. We plan to continue exactly as we're operating today through the end of this month. We know that the need will continue, and as with everything else with coronavirus, the COVID-19, it's fluid, and we will change and evolve as time goes on. So we're looking at continuing to increase testing availability in our area, making sure we're in it for the long haul for our residents to know what their status is.
Awesome, thank you so much. I think data is kind of an interesting topic. So Chris, Dr. Jackson, I'll put a question to you about what you guys are seeing and what data is telling you at Methodist. And then Dr. Basit, if you'll pick up at the end of their response and do the same for Memorial Hermann Sugar Land, that would be great.
Okay, I'll take this one for Houston Methodist Sugar Land Hospital. We fortunately are part of a bigger system, and from the very beginning we worked as a system to organize around patient safety, employee safety, proper protection for everybody, visitor limitation, et cetera. And in Fort Bend, we saw the highest volumes of positive COVID patients as compared to other community hospitals in our system. And that has pretty much stayed the same throughout. Willowbrook, I believe, also had a pretty good volume. We had the ability to move patients through our ICU into the medical center where we had dedicated ICUs, and over to our high infectious disease unit over at Continuing Care Hospital, a special unit for sort of a step-down unit, so we could move patients through and maintain our availability of beds. We peaked out here April the 11th. So we had the most patients that were under testing and positives April the 11th, and that was also true in our system. That was the date that the system peaked out. Since then, things have kind of dwindled down and plateaued at a kind of a low level. In the meantime, we are opening up our doors. I don't see COVID going away anytime soon. And we live in a world where we have infectious diseases all the time that we have to deal with, and we can handle all of that. So we've got specialized teams. We're keeping everybody safe. COVID patients are put on certain specialized units. We have specialized teams, which limits exposure and risk and limits the wastage of PPE for that matter. Then we can handle all kinds of things, and we are. It's amazing. We opened up, I believe, a week or two ago, and we're almost back up to our pre-COVID levels of operations. So it's safe to come here. We're great. So I'm feeling pretty good about it. Chris, you want to add anything?
Yeah, I think another, in regards to testing, another component is the surveillance testing that we do on our physicians and on our employees. And so we've been very active in terms of how we manage the surveillance testing for our employees. And what's been great to see is that we've had a very, very low positive rate for the surveillance testing that we've done for physicians and for our staff. And you have to look at the data, and I think the data drives all your decision making. And so we've looked specifically at potential areas that might be hotspots. We've done additional surveillance testing in those spots. Generally speaking, and you look at all of the communities that we serve throughout the 8-county region, Sugar Land or Fort Bend County is for sure a hotspot. We've all seen the data. Mm-hmm. And so we've done more surveillance testing here than most of our community hospitals across the Houston Methodist network. And fortunately, we've seen very low positive rates with our employees as a result of the testing. So it's been, we've learned a lot, as I'm sure everyone on this WebEx has from a healthcare perspective. I don't think anything else to add unless people have questions.
So I would say, one of the things that we've learned from COVID as a healthcare system is the importance of collaboration. I give kudos to Methodist and the other health systems in Houston for working together as one unit and initiating best practices all at once. I think that really helped to bring us together and have one message for the Houston area. Having said that, we have to learn from each other, and we've been talking to providers in different specialties and how to work best as a team, which providers are on the front lines, which providers are support, who needs to be accessing these patients, who needs to have physical contact with these patients. How can we minimize the spread of this virus, especially within the hospital system? And we've done a great job. And as Chris had just said eloquently, we have had a very, very low rate of employees being positive with this virus, which is amazing. And how can that be? It's because of all the efforts that we have done in the hospital, having thoroughly cleaning the rooms and the equipment, having temperature checks at the door, having a questionnaire that you have to answer, any visitors that having a very restrictive visitor policy. And just as we started to initiate our outpatient surgeries and elective surgeries, how can we do that? Which surgeries are the ones we start off with, and which surgeries come later? And what about visitors for them? And so I think we're going in the right direction. We're being cautious, and the reason we're being cautious is because this virus is much worse than the flu. And everything that we've seen about it, it spreads very rapidly. It causes a significant amount of damage to the lung tissue and other organs. And we're still learning about the virus and how it can affect the different parts of the body. And then how can we effectively treat it until we get a vaccine. And we'll talk about that a little bit later in this webinar. And I think as far as numbers in Fort Bend, I think I echo what Chris and Dr. Jackson had said. I think Fort Bend County has been fortunate. We've done a great job of sheltering in place and using masks and other protective equipment and limiting the spread, especially to our vulnerable population, like the elderly in nursing homes. And so for that reason and other reasons, our numbers have not been as high as some of the other hotspots within Houston or across the country.
So thanks. I think we've got some stuff coming in the chat, and I'm going to pivot off the script a little bit because we've covered some of the things that I wanted to touch on a little later. Juliet sends a question in for our docs. What are the most common myths around COVID-19 that physicians can dispel for patients? Dr. Minter, I'll let you start, and then we'll go to the other folks thereafter.
Okay, sorry, trying to get off mute there. So I think one of the myths that we hear a lot here is really based on misinformation or information that's out there that has been promoted recently. We get a lot of requests for antibody testing, and we have people saying, well, you need to be giving me antibody testing because then I'll know for sure that I don't have it and I haven't been exposed, or I have been exposed and I'm safe. So the reason it's kind of not a myth, but it's more information that is not fully developed. So we want to make sure that people know they're telling us, well, we know there's a lot of FDA approved testing and we just don't understand why you're not offering it. And so we try to explain to them that there's a difference between emergency use authorization and FDA approved. I know that recently, last week, I think the FDA did come out trying to make sure that they gave good guidance for people to understand that although there are a lot of manufacturers out there that are pushing antibody testing is more valid when you have a certain level of disease in your population. And so we're trying to make sure that people understand that there are limits to what current antibody testing and what serology can tell them. We don't know that there's not cross-reactivity right now. And we also are still learning what immunity we have when we get COVID testing. So for us, that's one of the big misconceptions or misinformation questions that we get to our health department is, why aren't you doing antibody testing when I know it's going to be able to prove what I have or don't have? And so trying to educate people to understand that we're not there yet with it being able to make certain assumptions about your level of immunity, what that immunity means, and what protection that gives you.
Thanks. Chris, did you guys want to jump in next?
I'll comment. I agree with everything Dr. Minter just said. The problem is there's a lot of things we don't know about this, but there are some things that we do know. And one of the things that we feel pretty comfortable about is the utilization of masks and gloves. And hand hygiene for that matter. This is spread primarily by droplet spread. That is, you talk and little droplets come out and they go a few feet and then they kind of drop to the ground. And people believe that when they wear a mask that that's going to protect them. We see people wearing masks and think they're safe. The fact of the matter is that the mask really protects the other people around you more than it protects you. That, you know, you speak, it blocks the mask, blocks that, and so one of the myths is that the mask protects you. Another myth, I believe, is that you see people wearing these blue rubber gloves and everybody's like, oh, you got to wear gloves. the gloves really don't protect you. First off, they have little micro holes in them that are plenty big enough for a virus to get through. And the real problem with gloves is that people feel that their hands are clean, so they don't have to wash their hands because they had gloves on. And what they don't realize is when they take the gloves off, the hands are soiled, and now they've got stuff that was on the glove on their hand, and they infect. People touch the face all the time, and the real common pathway to getting an infection is touching a surface and, you know, rubbing your mouth, your nose, or your eyes. So one really important thing is hand hygiene. I carry a little bottle of gel in my pocket, and I go to this frequently, but soap and water is ubiquitously available and is actually better than this. A good soaping and water will kill the virus, and you know, just keep your hands away from your face and wear your mask. And I think the gloves, frankly, are a liability because they give you a false sense of security, and you're more likely to soil your hands and then touch your face. So I'd like to, that's my comment on myths.
I think the general public wearing gloves out in the public, I completely agree with Dr. Jackson. It does provide a false sense of security. I mean, obviously in a clinic, in a hospital setting, we're going to be wearing gloves as we take care of our patients. So, you know, it is interesting, probably, and we see this with most infectious disease. Typically, if people are wearing personal protective equipment, the highest risk of spreading to yourself is when you take off your PPE. That is typically what we see in the healthcare industry as the biggest opportunity for spread. So for those in the public who are wearing a mask, who are wearing gloves, and maybe wearing gloves throughout a large portion of their day, they need to be careful about how they manage that process if they've been in contact potentially with the virus. And you have no idea if you've touched the surface. So, you know, my philosophy is, you know, I wear a mask. I'm mindful about what surfaces I touch. I gel or wash my hands frequently. And if you maintain those common practices throughout the vast majority of interactions, even in a hospital setting, you're going to be completely safe. I mean, frankly, it's safer to be here than it is in a lot of other places. So our hospitals are equipped with you know, and we're probably off topic, Mike, so I apologize, but the hospitals are safe environments. That's the point I guess I wanted to make. So I apologize for going off on a tangent there.
Can I make one elaboration of that statement? We have air filtration systems in our hospital that turn the air over six times an hour in a room, a typical room, and in a patient isolation room, it's every 2 minutes. Completely turns the air over. So these have HEPA filters, which filter out all the virus particles. That air is cleaner than you're probably having anywhere in the world. So actually, just walking around the hospital probably is pretty safe. I feel really safe here. So that's my added comment, Chris.
So I would echo what Dr. Jackson said. You know, one of the things that I learned that was important to me was this virus is very fragile. People think this is such a bad virus. Yes, it is once it gets into your body and starts replicating. But when you think about what it's made of, it's got a fatty core around it that hides the RNA inside. And so what disrupts that fat is soap and water. And so it's so easy to kill the virus with soap and water because it exposes the very fragile RNA inside. And so if you can sing happy birthday 2 times and wash your hands, that's it. The virus is gone, dead. And then the other thing that Dr. Jackson mentioned, and I think that's so important to know, is why is air exchange so important? And so what is it about being indoors that makes it more likely to spread this virus? And people, this is a myth or misunderstanding. It's that when there's adequate air exchange, open 2 windows and let the breeze come in, or go outside. Why is that so important? Because that air exchange, that movement of air, blows that virus away so that it's not concentrated. It's breathing in concentrated virus particles that really gets people. You know, going into a room that's aerosolized, people are coughing vigorously or they're getting a nebulizer treatment, that virus is all over the room. whereas when you're outside or when there's a breeze, that virus is spread out. And so that's not necessarily going to be as infectious as if you're indoors. And so that means that going out to a park or going outside with your family unit is safe. And so, I mean, I think we're all learning about the different viruses that are out there, and coronavirus is just one of them. And it's important to not only learn from this virus, but also be prepared in the future so that everybody is, knowledgeable about how to take care of ourselves.
Okay, that was really good, and a lot of kudos coming through in the chat. So excellent points. Dr. Basit, let's stay with you. And then Juliet, if we could loop in the slides on the trial, I think that we can just kind of jump into that as is our next point.
Okay, so I was asked to talk about something interesting that's kind of in the news right now, and so if you can, perfect. So when you think about the virus, why would we even talk about this tuberculosis vaccine? I mean, how is that even related? And so let me just give you a little introduction. So the BCG vaccine is a very weakened form of the Mycobacterium tuberculosis bacteria. It's not even a virus. And it used to be given to infants, young kids all over the world. And as the rates of TB plummeted, certain countries stopped giving it. So the U.S. doesn't necessarily use it in infants or children. Countries like Switzerland or Spain or Italy, they don't necessarily give it out either. But there are certain countries. India is an example. Portugal is an example. Certain counties in Ireland are an example. So they still give this virus to all kids at a young age. And what it does is it boosts your immune response. It helps to fight infections, not just TB, but other infections, viral infections, bacterial infections, pneumonia. It just gives you a booster in your immune system. We do use it in the U.S. It's made by Merck here for bladder cancer. Urologists will inject this agent to help our body's natural ability to fight bladder cancer. And so that's really the only approved use in the U.S. The next slide. So we talked about Spain and Portugal. So you know that if you look at a map, Spain and Portugal are next to each other. Portugal is a smaller country. It's bordered by the ocean, by the Atlantic Ocean, and really only borders Spain. Whereas Spain borders a bunch of countries. It has a much bigger international travel and airports and the like. And so they see a lot more international travelers. So if you look at COVID cases in these countries, so Portugal, I said, they inoculate their young kids with BCG vaccine, but Spain does not. And if you look at the cases in Portugal were greater than 16,000. This is not current, but only had 535 deaths. If you look at Spain, they had about 170,000 cases and greater than 17,000 deaths. Now, you can say, well, was this related to the BCG vaccine giving them some sort of an immunity, or could it be that Portugal started their lockdown sooner before they had many deaths? Could it be that Portugal is more locked away from the rest of the world than Spain? There are many different factors, and so what can we do to learn from this, and how can we prepare ourselves until there is a vaccine? Next slide. If you go to the next slide, please. Juliet. So one of the things that researchers have done is they've come out with a research protocol. So as you know, the vaccine is a year or more away. It takes a long time for a vaccine to be developed and properly tested. And so they have initiated a trial to look at the most at-risk people. These are the frontline workers, so the nurses, the doctors, and they've created a trial called the BADAS trial. And that trial is looking at the BCG vaccine in these high-risk people that work in the ER, the ICU, other parts of the hospital where they're in significant exposure to COVID-positive patients. And then they're going to give one group of these workers the BCG vaccine, and they're going to give another group a placebo, just an injection of saline. And then they're going to test them frequently to see who becomes positive and who doesn't. And some ethicists will say, oh, well, maybe this works really well, let's just give it to everybody. But until there's a placebo-controlled trial, it's not safe to be able to give a vaccine that doesn't have adequate data to support it. It may be that the Data Safety Monitoring Board will come in and say, oh, this vaccine is working really well, let's give it to more people. And there may be a time in the near future where we might be using this vaccine on the people that are much more likely to be exposed, and not just exposed a little bit, but exposed a lot. So all the time they're exposed to COVID patients, they're taking care of these COVID patients for many hours in a day, until there's a vaccine available or other therapies available that work. And so again, not something that you want to go out and get a BCG vaccine right now, but it's something to think about as we get more data and as we get more control studies to see, is this an option for certain people in the front lines to help prevent the virus from making people sick. And obviously, if you have a hospital without nurses and doctors and other support personnel, you can't survive. Those hospitals, as we have seen in Washington State, some hospitals had to shut down because people started getting sick. And so we want to prevent that at all costs to make sure that our community has the ability to take care of our sick patients, not just for COVID, but for other issues, heart attacks, strokes, and other things.
Okay, thanks, Doc. Juliet, I think we're done with the slides. So I'm looking through the chat box. There seems to be quite a bit of discussion centered around PPE. And obviously, Dr. Minter, that looks a little different for you than the hospital folks. So we'll start with you talking about management, supply, concerns, and then I'll punt to the hospital folks.
Sure. So for us, of course, our PPE, Health and Human Services, have the EMS for Fort Bend County. So acquiring PPE for our first responders, our EMTs, is what we have to do and what we've been doing all along. We have been trying to acquire more PPE recently to help out our long-term care facilities. And that's very important to us. Obviously, the most vulnerable patients, in general, long-term care facilities don't have or aren't used to the same supply chain and the same routes of getting multiple units of PPE. And so this is it's a brand new area for them. So as we've developed teams of infection control practitioners, as we've developed support teams for them going out to long-term care facilities that have many cases and that have one or two or none, we provide assistance with technical assistance for infection control, for education, for making sure they understand the right guidelines, and also helping them with ordering and supplies of PPE. And as they order and don't have enough or adequate supplies, we do assist them with that. Also, there are other people in the business community, small businesses who have high risk, maybe employees, and they're wondering, how do I acquire PPE? We don't know how to get hold of these donations. And so we can be a connector, a source. And then with some of the federal funding, there are ways that we can also assist people who need PPE to protect their workers and protect their population.
Chris, Dr. Jackson, did you guys want to jump in here and as far as your experience and just kind of management issues, concerns, what folks on the webinar should know?
PPE, probably one of my favorite conversations. Wow. So I think everyone's learned a lot about PPE, and we're accustomed to using it in a healthcare setting. So you would think that coming into this, that we would probably be ready for something like this. And in reality, what we've battled has been, to some degree, I guess I'll phrase it as what we hear through the media, through social media, is typically worst case scenarios. And that's not what we've experienced in the, Houston 8-county region. Frankly, we've been able to manage our supply of PPE very well. I'm going to put a plug in for just the healthcare systems in Houston and how effectively all of us have worked together, particularly coming out of the Texas Medical Center and the collaborative they created as a result of this in terms of, okay, so how do we manage this? How do we manage patients? And specifically, how we manage PPE and what is our inventory of PPE at each one of our hospitals across the entire area. So, from my perspective, I really feel like the healthcare response from the health systems throughout the greater area, and I'm not trying to leave anyone out intentionally, but Houston Methodist, Memorial Hermann, CHI, HCA, others, really has been outstanding in terms of how they work together to manage this and be consistent in terms of communication and practice. And so PPE was probably the single biggest topic of conversation day in and day out, Mike. And so when I think through the number of emails, of handouts, for instance, we have very specific 11 by 17 type handouts that we give to our employees. We put up outside of patient rooms that talk about if you're having this type of interaction, use this PPE. If you're having another type of interaction with a patient, use that type of PPE plus another level up. And then, so we've kind of had this tiered structure for how we manage PPE. As we worked our way through this, we also found that we were going to be required to reuse PPE. And so that's something that all the health systems in town have had to deal with, using reusable gowns versus, for instance, using disposable gowns, isolation gowns. And so at various times throughout these past couple of months, we've been on, as a region, maybe 2 or 3 days supply of disposable isolation gowns, and as a result had to resort to reusable gowns and how we would use them and how we would use them in patient interactions, but then how we would doff or take off the gown as we move from a hot area, so to speak, into a cold area. And so it's really been fascinating to see how we manage this. I guess what I will say generally, Mike, is that there's a lot of data and there's a lot of science that should drive our decision making and what kind of PPE we should utilize if we're in a healthcare setting. And we're using evidence to make those decisions and how we use it. What we're finding is that emotionally, what people want is whatever is scientifically proven to say this is the appropriate level of PPE for this interaction. Most people want that level plus, or that level plus. And so you have to manage the emotional side of this equation, which I think I can speak for everybody on the healthcare side of this call and say that has been an enormous part of this, is how do we manage knowledge, education, practice of utilizing PPE. That has been a huge amount of time and energy, not only from the leadership teams at each of the hospitals across Houston, but frankly from the infection preventionists that work at all of our hospitals. And again, I'm not referring just to Houston Methodist, but to all hospitals. It's really been an eye-opening experience for all of us. But I think the public needs to understand that we were never in a situation that was like Washington State, that has been like New York City. And as a result, we've been able to manage our PPE, and we've not had to run out. In most instances, I can say that across the greater Houston area, unless someone else wants to provide additional color to that particular comment.
So I would say that one of the benefits of being in a large healthcare system is that we have the ability to procure PPE at a larger scale. So the concern would be the smaller community or rural hospitals, and where are they getting their PPEs, and how can we better engage them to keep them safe. And I think one of the things that we've done is acted as a relief valve, so to speak, so that those patients that are COVID positive in these rural hospitals, we're able to transfer them to places like Hermann or Methodist and get the care. But definitely there's a opportunity there for getting PPEs out to hospitals or to clinics where they may not have the support structure of a large organization like we do here. So, but as far as what happened, I think Chris hit it right on the head. Initially there was fear. There was a lot of unknowns. Initially when the virus was first being discovered, and we were still having a lot of issues with testing. And again, I can remember that when you send out a test for COVID on our patients, it would take 5 to 7 days, and that patient had to sit in the hospital in isolation, and we were burning through a lot of PPE. And I think that was where we were afraid, are we going to run out of PPE because we're taking care of these patients that probably didn't have the virus, but we were worried about them having the virus. And so now we can have a result from the Abbott test within 20 or 30 minutes, which has been very important. And so when you look at the process in the hospital now, even before the patient leaves the ER and goes to the floor, we have a test result. And so now we can really feel confident that we don't have to burn through that PPE. And so now we have created a lot more of a stockpile of PPE than we had at any time before, or before COVID or during the initial stages of COVID. And so I think the public should rest assured that even if there is a spike of COVID cases, now that we're starting to relax some of the guidelines in the community, so that you can go out to restaurants or other places, you can come into the hospital for elective cases. Even if there is an uptick in the number of cases, we are confident that we have the number of PPE to be able to handle those patients.
Thank you. Chris, Dr. Jackson, I think we're all inundated by information, some of it not vetted, some of it anecdotal. What would your advice to folks on the webinar be in terms of where they should get their information, who should they trust, how should they go about making decisions, I guess in your best estimation or guess how that would happen?
You want me to take that?
Yeah.
Well, I absolutely think you should depend on Facebook, of course. That's the, just kidding. No, seriously, if you want good source information, we go to the CDC website or the WHO website. That has been our backbone for accurate, reliable, evidence-based information from the get-go. We have changed our stature and posture on the use of PPE, what's necessary on certain circumstances based on the evolving information. And I mean, what we did in the beginning with our PPE, for example, is different than what we do now because we know more about this virus and we know about more about the illness. So, and the CDC website in particular is very user-friendly. It has very clear information. Johns Hopkins also has a very good website with a lot of data on it that's sourced from all over the place that gives a lot of statistics and useful information, just accurate, up-to-date, reliable source of information. You know, the news that you get on the standard cable channels is typically very sensational and it's saturation and it just kind of wears you down. But if you want clear guidance, go to where we get our data, which is the CDC and the WHO and Johns Hopkins. Those are my comments.
Absolutely. I think the people should talk with their physicians. Their physicians should be tuned into this, so they're going to give them good guidance and feedback. I think the hospital systems, we have our act together, I believe, and I think we should be contacted. I would say organizations such as Access Health, they're a great reference as well. So there's a lot of great local resources that people should have a high degree of confidence in, and I would encourage people to do that. I'm going to say something, maybe it's not popular, but I'm going to say it anyway. You can pick whatever flavor of national media, regardless of whatever flavor you happen to like, And you can assume that there's going to be a large sensationalistic component to that information, and it's going to paint a picture that is typically one end of the bell curve, so to speak, in terms of information. So I would encourage you to look to a number of different sources, as Dr. Jackson just mentioned. I'm going to guess Dr. Basit, Dr. Mentor are going to say the CDC, WHO are good resources as well. And there are some sites, whether they're linked with a health system or with a university, that have excellent data as well. But you know, the local resources here, and everyone on this call as a panelist is an outstanding resource, and I'm including Mike and Access Health in that as well. I know he's a moderator, not technically a panelist, but Mike, I mean, the resources we have in Fort Bend County, I think, are fantastic. And from my perspective, the manner in which we've dealt with this as a county tied into a larger region, I think that we've done an excellent job in a very difficult, demanding, literally change by the day type of environment. So I think the county, I'm not trying to sound, I guess, too proud here, but I think the community should feel very proud of their healthcare providers in this community. I really do. So kudos to everyone on this call, frankly.
Couldn't agree more.
That was really good. Dr. Mentor, I'm going through the queue here, and there are some calls, some requests about data. So if you could point folks to the Fort Bend County URL where they can obtain some statistics and things, I think that some of the people that are chatting are wanting to obtain. And then beyond that, there were some additional questions about asymptomatic versus symptomatic testing. And then overall, what is your stance on who should be tested?
Sure. So first of all, at Fort Bend County, so fbchealth.org, we'll get them to our hub, which has data on it, and that will be updated. And I'd like to echo the comments that the other panelists have said as well. The collaboration has been wonderful. The partnership has been amazing. We are utilizing everything we can in this county. I talked about the numbers that people will see on our hub and on our website, and people ask, well, why is it still going up? And I said, well, every time you add one case, it's going to go up. So different ways of showing the information, it does help people. So we're experimenting with different ways of showing the information. But we also want people to know that every bit of that information, every number that is there represents not just a case, but a person. And if it's representing a person, then it's representing one of our neighbors. It's representing one of our neighbors, then that reminds us of what we need to do. We need to make sure that we are continuing to physical distance to protect our most vulnerable neighbors. We need to continue to wear our face coverings to protect other people. We need to continue washing our hands with soap and water to protect our neighbors. That's the way that we have done as well as we have. That's the way we will continue to do well. So as far as the numbers that people are seeing and how things are going up and coming down, I also would agree with the comments that were made about what you get in the media. Please, please, please go to trusted science-based websites and information sources as the CDC and the WHO. And yes, I agree. I go to Hopkins as well to see how things are displayed. I think they display things very, very well. But one of the main reasons is that when you go to, you have to remember the goal of any of the news outlets. And it is to inform with the purpose of keeping you coming back. And so that information, a lot of times we're asked, why does that information look different than yours? We have no idea where they're even pulling the numbers that they get, and it's very difficult to respond on the spur of the moment to data that they pulled from multiple sources that they put together to paint a picture to tell a story. I'm not faulting them for that's what they do, but I am saying that doesn't give you the best picture that will give you the best information to take care of yourself and your neighbors. So again, I can't reiterate the advice that's been given over and over again, that you really need to go to a source that the only purpose is to give you good information. There's enough changing, as we've said before, enough information that's changing day to day as we learn not only about the virus, but about ourselves and what we do and how we interact while we're trying to eradicate the virus, that we don't need the extra input with different motivations to be following that. We just need to follow good, solid scientific data that's solid for today and solid for next week, and at least is based on as much evidence as we have.
So that's really good. Thank you. I think we've hit most of the questions that are in the chat. Juliet, if there are some other questions coming in through Facebook Live, then I guess we can put them in there or address them. At this point, let's just kind of let everybody do some closing remarks and just kind of wrap up. And then if there's anything pressing that comes in through the chat bar, I'll call our attention to that. So
okay, sounds
Basit,
good.
Yeah, Dr. Basit, did you want to start?
Sure. So I want to thank Fort Bend Chamber for organizing this, and I think this is something that we're going to be doing on a regular basis. Information is power, and so certainly good information is what you need to use to live your life and understand that this virus is here with us. However, we have to be able to live our life safely, and so take the advice that you've gotten here, take the advice from CDC and WHO, and go and live your life. There's a whole world out there, and people have to work, people have to eat, businesses have to run, and I think we have to balance that disease versus the economy. And so we have to be able to get back to work in a way that's safe. You know, hospitals are open, and the reason we're opening is because the disease numbers have gone down, because we feel that it's safe, not because not because we want to be open ahead of time or prematurely. And so feel confident that we're only going to open and do procedures or have office visits when it's completely safe. I'm seeing patients every day in my office. I'm doing procedures in the hospital, and I would not do it if I didn't feel 100% that it's safe.
I couldn't agree more, Dr. Basit. You know, it's what's been unfortunately an unintended consequence of dealing with COVID is people putting off taking care of their own health. And we've seen some alarming data locally and nationally regarding how people are managing their own health. And I think what Dr. Basit said is right on point. Would encourage people that it's very safe to come back into the hospital. And if you need care, you should be seeking that care. Work through your physician and come into the hospital as needed. And I think it's safe. We would not be. I raised a family in this county. I'm not going to tell people something different than what I would tell my wife or tell my friends or my neighbors. It's safe to go into a hospital setting, and we've unfortunately seen dramatic drops in STEMI, in heart attack data nationally. We've seen changes in stroke data. So people are not necessarily taking care of themselves because they're afraid of coming into a healthcare setting. Please don't do that. That's really not the best thing to do. Dr. Jackson, did you have a comment?
Well, I would echo something Dr. Basit said, and that is that he said you got to go and live your life. We are in this for quite a long time. I have a feeling that we're going to be living with COVID for the next few years until it kind of runs out. We've figured out how to live with it and to be safe, and our social interactions are going to be quite a bit more muted, but you know, we got to deal with this for the long run. So the whole key is to use good common sense about keeping your hands clean, the social distancing. That is not going to go away anytime soon. So my message is, yes, live your life, but just be safe and be consistent. It just takes one error and you will infect yourself.
I agree with all the comments that were given, and I would say that some of the guidance, closing guidance I might give is to assume some personal responsibility. But we can't. The healthcare system, public health, we can't anticipate every unique situation. agreed with everyone here that this is going to be around for a while. We do adjust, but we want to make sure that we take some responsibility, stay informed with good sources, and then take those basic actions that will help to protect you, your family, and your neighbors. Also take an honest self-assessment of your risk. Don't put yourself in any more risk than you should. Remember what group you're in, but as the other gentlemen on the panel are saying, there are other risks that are greater to your health, to your personal health, if you do not take a good assessment of your other health risks and what you need to be doing to protect yourself in other environments to make sure that you are taking care of your general health. So we just want to make sure that you continue to know that we are going to have to navigate this for a while. And we're here to help you navigate it. You've got trusted sources. The information may change as we learn more, but we're here. We're looking at that information. You can do the same. Continue to ask questions, and we'll make it through. We will make it through this together.
Thank you very, very much. I think that was all extremely, extremely great information. Lots of folks with lots of really powerful comments, and big thank you from the folks that are on the webinar. The Chamber wants me to call attention to May 20th. There'll be a second in the series of healthcare webinars. Next week's will center around telehealth. So stay tuned for more information on that. Also, there is a State of Higher Education webinar scheduled for Friday, June 26th at 11:30. So again, stay tuned for more information on that. I'll close and tell everybody to stay safe, stay healthy. We appreciate all the attendance and the folks that are involved in providing the information, and certainly those that have dialed in to obtain the information. Last, a big thank you to the sponsors, CHI St. Luke's Sugarland, Fort Bend Medical Society, Memorial Hermann Sugarland, and Houston Methodist Sugarland. Signing off, everybody be calm, stay safe, have a great day.
Thank you.
Thank you.